Welcome to
Monday with the Mavens.
Okay, you guys, we have some questions here, and we're going to jump in. We're going to try to keep it short and sweet, but we had some good stuff sent in. We had a few questions we hadn't answered yet in stories, and then we had several that came in on your question box. So let's get to it.
Yeah, real quick, we may look like we're a little red tinted because we're under a red umbrella. We're not sunburned, don't worry.
Yeah.
And then the other thing is I forgot my tripod, and so things are propped up kind of precariously. So if our phones fall forward, don't worry. We will set you back right.
Keeping it exciting today.
Yep.
Okay, we have these in no order. So we are answering questions for both medical mavens and macro mavens. So we're going to have nutritional and clinical things on here. We're going to try to keep it quick.
We will keep it quick.
You want to go first?
Sure.
Okay, let's do it.
All right. I'm traveling a lot this summer. How do I stay on track? I'm assuming this is having to deal with macros. So traveling is actually super easy. As long as you are willing to be a little bit flexible. Mm-hmm. So if you are the kind of person who needs to be very specific about what you're doing all the time, if you're a little bit more type A, then making sure that you have a plan ahead of time is really important. So depending on what you're doing, like especially in the summertime, a lot of people are going camping and doing river trips and things like that. And I actually think it's easier to plan for those things because you already know, like, okay, I'm going to make, whatever it is, grilled chicken for dinner. Sorry, we also have a lot of dogs around us too. So you oftentimes already know what you're going to be making for dinner, what other people are going to be bringing because you don't want a bunch of extra food. And so that's easy to track ahead of time. Also, sometimes depending on if you, let's say you're going overseas somewhere, you might want to loosen things up a little bit and just be really mindful and track your protein and your calories. And you can be a little bit more flexible with your fats and your carbs. That's totally fine too. Or if you just want to be like, you know what, I'm going on vacation. I don't want to track. I'm just going to be really mindful about what I'm eating and really focus on building your meals around proteins. That may work for you too. So there really are a whole host of different ways that you can do it. I think it just kind of depends on where you're at in the process, what your goals are, and how soon you want to get there.
Yeah, absolutely. We do have a really great tool for people that are traveling. It's not on our toolbox. We have so many free resources on our toolbox at macromavens.life, also medicalmavens.life. They have two separate toolboxes. That traveling one is one we just have for our clients. So if you're a client and you are getting ready to travel or you have future travel plans, absolutely make sure you communicate that with your coach because we might shift some things leading up to and then upon your return. And that's why having a customized plan and coach is so important. So we would love to help you. Okay, let's see. What are your thoughts on the use of testosterone pellets? This question came in on the medical maven side, and I'm sorry.
We don't have a gremlin.
We don't.
She may sound like a gremlin, but she's just a little beast.
Okay, so first of all, testosterone pellets, I'll just explain them in a nutshell. It's a small pellet that's inserted typically on the buttocks. Both men and women can use them. And the goal with them is that it slowly releases testosterone and sometimes some other things into your system, and so it can last a lot longer than having to utilize a weekly or a daily, let's say, injection or prescription of some form. I have opinions on pellets.
Weird.
I know. I do think there's absolutely a time and a place for them. I think that they became so wildly popular for a long time in hormone specialty clinics, and I do think that they still have a use. For me personally, I think that the drawbacks of using testosterone pellets is that it can be more expensive. Depending on how you metabolize your hormones, it's hard to manage once you have the pellet in. It's really hard to then change the management of either decreasing. You could always go off of wireless.
Sorry, guys.
Okay, we're back. We shouldn't have a poor connection, but...
Yeah.
And so I do think that due to expense and due to the inability to really closely manage, also it is a minor surgical procedure and it can be uncomfortable. And there's pros and cons to it. In my opinion, I think more than not, going a route outside of a pellet is ideal for the specificity and management. That is just my personal opinion. There's a lot of different opinions from clinicians. I've seen more drawbacks with pellets than I have with other forms of testosterone therapy. And we work with both men and women on testosterone therapy. The first thing to do is obviously do like a thorough consultation and seeing where you're at, and then also look at where you're at from a laboratory perspective so that we can get you not just to what would be considered, we look at reference ranges on labs for sure. We also go off of symptoms, but we're going to want to get you to ideal or optimal levels, not just the standardized reference ranges, which oftentimes are based off of crap, in my opinion.
Yeah, so I think that in a nutshell, it's a pretty individualized decision. Yeah. There are lots of options. Just because your healthcare provider says, I think you should be on a pellet, you should ask lots of questions. Like, why not a cream? Why not an injection? What is the benefit to you specifically if that's what that person is suggesting? And really, it's our duty to question our doctors. I always try to go in with a bunch of questions. And then if I feel like I don't fully understand, what my practitioner is telling me, I try to make sure that before I leave, I have a really good understanding of why we're going in a certain direction that we are going.
And I know a couple people that pellets work really well for, and it's so interesting how your mind gets changed over time. I used to be a pretty big fan of pellets. I still do think they have their time and their place. I just think that more often than not, there's likely a better route to go that gives you more specificity and is less expensive. There is convenience in a pellet.
Sure.
So, yeah. Okay, you're
all right. Next.
Oh, real quick, on testosterone.
Yeah.
If you are interested in knowing what your levels are, that is such an important thing to know, regardless of age. We work with clients 18 and older with Medical Mavens, and we do a thorough consult, and then we always have your labs tested. We look at your labs. Depending on where you're at, we're going to want to make some lifestyle changes likely, maybe suggest some supplements, but then there is a time and a place for using bioidentical hormone replacement therapy and or peptides, depending on what your scenario is. And that is something that we can do from the privacy of your own home. So if that's something you're interested in, it's medicalmavens.life. And we have our $99 consult right now, which is amazing. And we pass our lab savings on to you. If you're a member, you actually have baseline labs included. If you want to just do a one-off, they're still super reasonably priced. So there you go.
Perfect. Nice. Nice plug.
Well, thanks.
Can I sign up for Medical Mavens if I just want GLP-1? So the short answer to that is yes. Let's talk about GLP-1s real quick, because as you guys will see, as we get into some more of these questions, there's a lot of chatter out there about GLP-1s. If you don't know what a GLP-1 is, it is a peptide that is pretty hip, pretty trendy these days for lots of good reasons, you guys. There are, and we have talked about GLP-1s quite a bit.
Yeah.
But there are lots of benefits to using this peptide. It's not just for fat loss or weight loss, which a lot of people are using it for. It is originally, still is used as a medication for diabetics because it really interacts with your insulin, and it's been life-changing for so many people who are diabetic. So if you're diabetic, if you're pre-diabetic, it might be something that you want to ask your practitioner about. If you don't have a practitioner who knows about it, you can go to medicalmavens.life, click the schedule now button, get in on that consult, that $99 consult. But a lot of times I have several clients actually over on the Macro Mavens. Why did we do that to ourselves?
I know.
On the Macro Mavens side, who are using it to help with their fat loss journey, and it's been pretty remarkable for that too.
Yeah.
And a lot of those clients are seeing reduced inflammation numbers. They are sleeping better. They are feeling better. There's a lot of cognitive benefits to it also. So anyway, the question was, can I sign up for Medical Mavens if I just am interested in a GLP-1? Yes, we actually have a GLP-1 program specific for people who are just interested in that. The beautiful thing about it is you can have your labs tested, and we can have a hormone protocol if you need that also, and it can work beautifully simultaneously to get your hormones balanced and to get you on your track to feeling your absolute best in all ways. So
yeah, and we have other GLP-1 questions in here. I think it was, like Haley said, the hot topic. But one of the things that I think sets us apart, and GLP-1s is also something I've had my mind changed on and that's why I think being a flexible thinker, being open to having your mind changed, I was pretty concerned about them for a while, especially when they're used at a diabetic dose for people looking to use them just for fat loss that are non-diabetic.
Well, and that's something you need to talk to your practitioner about also. Is like, sorry, I don't mean to jump on you, but you should be taking the smallest dose possible to get the results that you want, right? Like, why should you take more than you need? Anyway.
That's what I was going to say.
Sorry.
No.
Give it to me.
So, yeah, no, I love it. One of the things that we do is where appropriate microdose. And that is something that if you can work with a skilled practitioner and understanding how to microdose, meaning starting at the smallest dose, potentially working your way up, but then also having a really good strategy for when you come off the GLP-1, because a lot of people think they're going to have to take it forever, and you don't. We don't want you to have to. We want to use it as a strategic tool where necessary. Not everybody needs it, but we also then have a really great educational platform, and Macro Mavens can help with that to make sure that you are preserving your muscle while shedding fat. Because my fear for so long was that people would use these, that they wouldn't have hunger, they wouldn't be eating enough protein, they wouldn't be doing resistance training, and they would lose, a lot of people lose a significant amount of muscle along with fat. And then if they stop taking it and they just start increasing their calories without a plan to reverse their calories up, then unfortunately they're left with less muscle, and then they gain fat back and they're less healthy. We reverse that. So we want you to preserve your muscle while you're on it, shed fat, and we have a whole plan for that, and then a plan to come off of it so that you're left with a leaner body mass and the benefits, but then can re-increase your calories in a safe way. It's a beautiful thing. So you get the best of both worlds. It can be used safely, and there are some really other beautiful benefits to it.
Yep.
Yeah.
Totes.
Okay, let's see. If I go over on one macro, do I still hit my other targets, or do I just hit calories? That's a great question. Who is that? Who does that sound like?
It's a cartoon character.
The Bugs Bunny, Bugs Bunny.
The guy with the hat.
Elmer Fudd.
Yeah.
Yeah. Okay. Anyways, it really, I think, once again, it depends. Now, if let's say you went way over on your fat and you're already over on calories and you're not hungry, I would just call it a day, and then the next day just start from
fresh,
scratch,
yeah.
hit your numbers. Let's say that you're like significantly under on protein and you're, still have a little, like, you're going to want to get as close as possible. So I think it's just the reason that you want to hit your yellows every day. A specification makes such a difference when we're really working to get that metabolic threshold to rev. And so it is important to hit what we call your yellows if you're one of our clients every day. So if you hit your protein, your carb, and your fat macro each day, you automatically hit your calories. And if let's say you hit your protein and your calories, great. If for some reason your fat and your carbs are washed out, we don't want you to do that every day, but that's best case scenario if you're off on one, to sub your fats and your carbs. But you get to know that as you're working through the program. But if you are way over on calories and under on 2 macros and over on 1 and you're not hungry, don't force it.
No.
Just start over the next day.
Yep. Every day's a fresh start.
Sure is.
All right.
Keep them coming.
How do you personalize hormone optimization for each client? So this is a Medical Mavens question. This is a great question. So if you are a Medical Mavens patient, not client, patient, and we have your hormones tested, then that is how our practitioner is going to know either what you need to add to, what are you doing?
I was waving at people. I get really excited.
Yeah. Anyway, every person, just like with your macros, every person is individual. And so everybody has different needs when it comes to hormones. And so what you do is you would come in, you would have your labs tested. Our practitioner would look at your labs.
You wouldn't come in, you'd do it for your privacy.
Sorry. Yeah, you're right. You would go and have your labs tested. Those labs get sent to our practitioner. She looks those over, and then makes a decision with you based on what are your goals, how are you feeling, what are your symptoms, what do you want to come out of this, and what is best for you in your particular lifestyle. So whether you need to be on progesterone, or maybe you need testosterone, or maybe you have too much estrogen, whatever it is, it's very individualized depending on the need of the specific person. And so that's where we actually have a quiz, a Medical Mavens quiz, that's really a great tool for you guys to go through. You can go through it. It only takes a few minutes, and you can basically rate the symptoms that you're having. So let's say that you are having crazy night sweats every single night. Well, you can go onto our quiz and find out, like, oh, I might have, some severe hormone irregularities going on, and I want to go in and be tested for that. And so our quiz is a great way for you to see whether or not Medical Mavens might be a good fit. So,
you know what's really fun, you guys?
ooh, what?
So I've been in the world of hormones for a long time, and you get to the point where you can kind of look at a person. This isn't just completely clinically, but you can kind of look at a person. You can look at their eyes, you can look at their skin, you can look at their hair, you can look at where they store fat, you can look at their energy levels, all those things, and you can most of the time you can think okay, this person probably has PCOS, polycystic ovarian syndrome. This person seems testosterone dominant. This person seems estrogen dominant. And it's so fun now to get a feel, especially because so many of our friends and our families have gone through Medical Mavens, but to really have a sense and then see their labs and you're like,
yep,
confirmed, and we can help you with that.
Yeah. So anyway, go over to medicalmavens.life, take the quiz. Even if you're just curious, like I said, it only takes a couple of minutes. It goes through lots of different categories. But it is a great tool to see whether or not you should be concerned or not.
Sure is. Yeah. It's fun too. Okay. What's the deal with GLP-1s? I think we answered that for the most part. Just nutshell is, GLP-1s are a peptide. Some people know them under the names of Ozempic, Wegovy, tirzepatide, semaglutide.
I heard a new one today. It starts with a Z. I can't think of it.
It's all
something.
Yeah, it's all the rage. They just need to be used responsibly. There can be a lot of benefits to them, but they need to be used responsibly. You need to preserve muscle. You need to have a plan to safely come off. You likely need to microdose. Not everybody does. Not everybody needs them, but they are a fantastic tool, and it is something that we can prescribe at Medical Mavens.
Yeah. One thing, too, about GLP-1s that a lot of people don't realize is your body produces GLP-1s, you guys. It is a peptide that our bodies produce. And oftentimes when you eat meat, your body produces it because it helps to regulate your insulin. But it's a natural occurring thing within our bodies. And when you go on a GLP-1, sorry, that's a distraction. When you go on to a GLP-1, you're not introducing something that your body isn't already used to. Your body is used to having GLP-1s in your system. So I don't know. I just think it's so cool that, that the medical world is where it is today, and that people are utilizing things that our bodies do naturally. And maybe they don't do them as well as they should be doing them, and have created a way so that, people can benefit from it. It's just cool.
Yep.
We live in a cool time.
We sure do.
Okay. Best source of easy protein. Well, that kind of depends on what you like, right? I think a really easy source of protein is chicken. So boring, but it's super easy. Chicken. I like steak. I like salmon. I like chopsticks. I like yogurt. I like cheese. I love cheese. I wouldn't call cheese a good source of protein, but you get a benefit. You get a protein boost with some fats.
Yeah.
Those are some of my favorites. Deli meat. I like deli meat. I eat a fair amount of deli meat. Ham, roast beef, eggs. Turkey. I like eggs. Mm-hmm.
Yeah. Those were all, I think, animal sources of protein, which is my fave.
Yeah.
But we have a whole, speaking of our toolbox, macromavens.life toolbox. If you go on there, we have a list of each macro broken down, easy ways to get them. We have shopping lists. We have all the tools that can help you with that. So
mix and match. Is the mix and match on there?
It is.
Okay, so that's actually a great tool. It's probably my favorite tool, mix and match macros. So if you are tracking your macros, and we had a question earlier, if I'm over on one and I still keep going or whatever. What's great about that tool is that it gives you different combinations. So let's say that you are trying to find something that is high protein, low carb. You can go to there. It'll give you a bunch of options for that. If you're looking for something that's low fat and high protein, you can look on there, and it mix and matches all of these different macro sources, and it's really a great tool. I know a lot of my clients have it printed out on the side of their fridge. It really helps if you are kind of in a pinch and you're like, I just need some carbs. I need 12 carbs. Yeah. It's on there for you. Anyway,
and
it's a good one.
The bottom of it is cool because it has a section, especially for those that are in a cut that are looking for higher volume, lower calorie foods. It's just fun.
Yep.
Okay. What exactly does Medical Mavens do? Okay, I'm going to try to do this in a nutshell. So we are basically an online healthcare provider that specializes in hormone balance, thyroid balance or support, autoimmune management, and peptide therapies. So we don't take the place of your primary care necessarily. Not everybody necessarily needs a primary care unless if you
Unless
I
you
wouldn't
do.
go into that, yeah. But we can work with you from the privacy of your own home or anywhere. Our prices are super duper reasonable. Our services are killer. You can have labs done in anywhere that you live. Right now, we're offering services in Florida, Utah, California, Oregon, and Idaho, with more states to come. And depending on how your labs look and what the treatment plan may look for you, obviously we're always going to want to try to minimize or eliminate medications where needed, but there is a time and a place for them. If you are in need of a bioidentical hormone, we can prescribe that. If you're in need of a peptide, you can prescribe that. We work with a lot of different peptides, not just the GLP-1s. We also work with things like BPC 157, which is for healing. I personally am using that right now and I'm loving it. If you have any either acute or chronic injuries, that's what I'm using it for, to just really get ahead of some little issues that I'm having with my shoulder, my glute to hamstring attachment, and my Achilles. And so there's just so much we can do in a customized way that is from the comfort of your home, and it's amazing. medicalmavens.life, and you can hit the consult button for a whopping...
I think it's schedule now.
Schedule now button. Yeah, schedule now button.
Yeah.
Do that.
There's not a consult button.
Schedule now.
Can I eat what I want on a macro plan? Yeah, totally. Yep. I eat what I want every day. That is a very simplified answer.
Yeah.
You will probably have to shift around some of the things that you eat if you're on a macro plan, most likely, right? Because you don't get to a place where you're like, man, I feel like I need to change something up without actually needing to change something up. If you think you're going to get results out of doing the same thing, you're crazy. So don't be crazy. But it also doesn't have to be a completely outside of the ballpark shift for you. In fact, what we want to do here at Macro Mavens, I had to think about that, at Macro Mavens, is we look at your lifestyle. Before we give you your first assignment, we look at your lifestyle, we look at your goals, we look at what you're already eating and what a typical week looks like for you, and we give you an assignment based on that. We're not going to tell you, if you only eat 50 grams of protein a day on average, we're not going to tell you that you need to start eating 180 grams of protein. It's just not, that is not possible.
Most people don't need 180 grams of protein.
I'm just making up numbers. It's not manageable. Instead, we're going to give you something that is manageable for you, that may be a little bit, it may be a little challenging in the beginning. I'm not going to lie. The first weeks of being on any type of plan are oftentimes the most difficult weeks. Usually that's trying to figure out what foods do I eat that are going to fit within the boundaries of my macros. And then once you get really comfortable with how to play with your macros and your food, then, there are a million things that you can do to allow yourself accommodations for the things that you love.
Yeah.
There is no reason why you can't have dessert or a glass of wine or whatever it is that you love, either on a daily basis or from time to time. You just have to be able to get creative and be willing to work at it. And that's what we are here for as far as coaching goes. We can teach you all the tips and tricks on how to make it work for you. But yeah, I think that I actually, when I very first started tracking my macros, I felt like I had more food freedom than I ever had. And there was really no guilt around my food choices, because I would choose to eat things that fit within the boundaries of my assignment. I was still reaching my goals and enjoying the foods that I was eating, and still do. I've been tracking now for, it's been a bit. I've been tracking now for at least 4 weeks. I did take about a week off, but I've been tracking really strictly for the last bit. And there is freedom in that, you guys. There are freedom within boundaries. I like that.
I like that too.
Yeah.
All I'm going to add, and I say this often, is I eat chocolate virtually every day, and I often eat bacon. I fit a lot of different things in, but if there are things that you love that are important to you, you can absolutely fit them in.
Yep.
We also will work with you on trying to reduce inflammation by choosing less inflammatory foods, but that's a whole educational process, and you get to lead that charge.
Yep.
Okay, any specials? Well, I'm so glad you
asked.
Yeah, we actually have specials. We don't always have specials going on, but we actually have specials going on both Macro Mavens and Medical Mavens. So right now at Macro Mavens, it's 25% off your first month on a 6 or 12 month plan It's such a great time to sign up, you guys. It is easy to track in the summer. I mean, it's easy to track year round, but some people are like, oh, it's summer. Da, da, da. No, like you can make anything work. So you just go to macromavens.life and you click the hop on board button, and that's a free consult. So it doesn't commit you to anything. It just lets one of our coaches reach out, see if we're a good fit, and we'll make sure you get to take care of the special.
Yep.
Medical Mavens, right now, we are offering a $99 consult, which is crazy. You can use your FSA or your HSA. We can also provide you a super bill if you want to submit it to your insurance, but it's still less than most people would pay for their deductible, co-insurance, copay, any of that. And all you do there is you just go over to medicalmavens.life and you click the schedule now button, and you'll just schedule directly from there. That'll get you scheduled on your consult. We have availability, and once again, we are in Florida, Utah, California, Oregon, Idaho, with more states to come.
Yep. All right, last question. Oh, we've already answered this. How do I know if I need Medical Mavens? Take our quiz. Take the quiz. In fact, we can't. Well, what I can do
when we post this, we can put it in
the copy. No.
Nope. In the comments.
Yes.
Or go to our bio.
Yes.
On Medical Mavens.
Or just go to medicalmavens.life. There's a button that says quiz, symptom quiz. Click on that. Literally takes you a few minutes, you guys, and it gives you a lot of education.
It's actually really fun.
Yeah.
I love taking
I've taken it a lot.
Yeah. I know.
But it gives you a lot of education. After your quiz is done, it'll give you a write-up on some lifestyle things that you can do to help change your situation if that's what you want. And then it'll also link you to sign up if that's what you need. So anyway, take the quiz at medicalmavens.life. Hop on board over at macromavens.life. We would love to work with you on both platforms if you need it, if you're interested.
And we're so glad we could come to you red and cheery from this umbrella.
Yeah. It's warm here in Oregon.
Yes, it is. All right, you guys, have a the best day, I should say. Thank you for joining us. Let us know if you have questions. Take advantage of our specials. Macromavens.life, medicalmavens.life, and we will see you again soon.
Bye.
Bye.